Then this just in late tonight, minutes ago, more signs some Democrats are feeling the heat. Two congressmen in tough re-election races now asking the president and Congress to extend the Bush administration tax cuts, all of them, including the ones for the rich. Alabama's Bobby Bright and New York's Mike McMahon want to push back at least another 2 years to the end of 2012. Reaction now from Republican Indiana Congressman Mike Pence. Congressman, what do you make of all these developments?
Hey, Neil. Well, I think it's encouraging to hear the Speaker of the House today essentially announce that they're not going to try or they can't, in fact, ram the Senate bill through the House. But I got to tell you, it's still disappointing to many of us, and I expect millions of Americans, that that liberals on Capitol Hill continue to focus on some new health care legislation when the country wants us to get spending under control first and foremost, and they want us to take decisive action to get this economy moving again. I think. Well,
apparently your two Democratic colleagues on this tax cut, so that's
right.
Rather startling here, and
yeah.
I don't know whether that's a tempest in a teapot here, but what do you make of that?
Well, I think it means that, at least in the case of those two Democrat colleagues, that they're getting the message. But, you know, we'll have to wait and see to the State of the Union address whether or not this president and the leadership in Congress has gotten the message. Look, Neil, we've talked about it many times. We need health care reform in this country that lowers the cost of health insurance and lowers the cost of health care. We ought to take time and develop some incremental legislation that will bring that kind of relief. But the number one priority for the American people today, right after national defense, is getting this economy moving again and getting runaway federal spending under control. At least a couple Democrats know that. But I got to tell you, it's frustrating to many of us that while you said it sounds like a retreat, it sounds to us simply like they're regrouping and planning another assault on America's health care system, and that's frustrating.
All right, so what do Republicans do? One thing that's interesting, Congress, when you read these exit polls or samplings, I don't know what the right word is, out of Massachusetts, it's that health care itself, just using that word, has so many negative connotations. So do Republicans feel leery doing anything on it for fear that if it looks they strike a deal, let's say on handling pre-existing conditions or portability of coverage, all things that are probably desirable by both parties, the Republicans just don't want to touch it because it's now like a third rail?
Well, I don't think it's so much about politics. I mean, Republicans offered an alternative on health care reform that allowed people to purchase health insurance across state lines and had reasonable limits on punitive damages in malpractice cases, and we even used those savings to deal with pre-existing conditions for many Americans. We're ready to talk about modest incremental solutions that will lower the cost of health insurance, but I fear what we're going to see them try to do here, maybe with some new version of a gang of 12 in the Senate to launch it, is essentially, Obamacare minus 10%. And the American people are focused right now on getting this economy moving again and getting spending under control in Washington, D.C., and that's where this Congress should focus.
Congressman Pence, always a pleasure having you. Thank you very much.
Thanks for having me, Neil.